All right, so I'm looking at your file here. It looks like you have a desk job, and you're doing a lot of computer work, typing, using the mouse, using the keyboard, all that stuff. Yeah. All right, and then it says that you're having some little bit of mild discomfort in like your fingers and your wrist area. Okay. Well, today I think what we're going to do is an examination of your hands and your wrists and a little bit of your forearms. Does that sound okay? Okay, awesome. Let's get started then. So I'll just have you start. If you can just set your hands out on the table for me. Palms down. Thank you. And so I'm just going to observe, looking for any signs of scarring or swelling. Looking for abnormalities, any nodes, changes in the skin, and making sure that the nails look healthy, not too brittle. All right, and that looks good. So if you can just flip your hands over for me, and you can just rest them right back down on the table again. And again, I'm just looking over your palms and inside of your finger, checking for any wasting, scarring, just any kind of abnormality that I may just be able to observe visually, but I don't see anything, so that looks good. So now I'm just going to check your pulse, okay? So start here on the left, and that feels pretty good. So I'm going to do the right. All right, and that feels normal as well. So now if you can just bring your hands out in front like this. Okay, and now I just want you to touch your shoulder. Good. Okay, and just hold them like that for me. I just need to inspect your elbows. I just need to inspect your elbows. So I'm just looking for any rheumatoid nodules. I'm looking for any psoriatic plaques. And that looks pretty good. And that looks pretty good. So if you don't mind, oh, all right. So if you can just give me your left arm, and I'm just gonna feel down your forearm here and make sure there aren't any nodes or just anything that would be of concern. Okay, and now if you can just give me your right, and doing the same thing, looking for nodes or anything that would be cause for concern. Okay. Okay. All right, so now if you can just set your hands back on the table for me, like so, and I'm just going to feel your palms here and checking for any wasting in the palms, any contractures, making sure they feel healthy. And that left looks good. So let's do the right. And again, the same thing, just checking for wasting, any kind of contractures. Trying to observe that everything feels healthy and as it should. Okay, and that's looking pretty good, so just go ahead and flip over for me now. And now I'm just going to check temperature just with my hand. So I'm checking at the wrist here and then on the hand itself. And I want to make sure that it feels warm, but not too warm. So basically just checking for signs of inflammation within the joints. And that hand looks good, so I'm going to do your right now. Again, just checking temperature and just checking for signs of inflammation. A lot of joint structure here, so there's a lot of potential for inflammation, so we just want to check that and make sure that that wouldn't be a cause of the discomfort. All right, and that feels appropriate. Okay, so I'm going to take your left hand now, and I'm just going to just kind of move it around and test mobility. So let me know if you experience any pain while I do this. Does that feel okay? How's that? Okay, and so we'll do the right. So same thing, any pain, any discomfort? No? Okay. All right, well that's good. So now I'm just going to squeeze your hand over these joints here and just let me know if that hurts, okay? So do the left. Does that hurt? Okay. And the right. Does that hurt? Okay, good. Okay, so now I'm going to go back through the hand. I'm actually going to test every single joint of the finger. So slightly squeeze and manipulate each joint through both hands, and we'll test just to make sure that we're not missing anything with the more gross assessment, and check the structure of each joint. Okay, so I'll start with your left hand again. Okay. All right, does that hurt? Good. Does that hurt? Good. Does that hurt? Okay. How about here? Good. About here? Okay. Next finger. Any pain? Good. About here? Good. And this one? Awesome. About here? Okay. And now here. It's good. This one. It's great. And last finger. Nothing. Okay. Here. Good. And last one. Awesome. All right, so I'm going to switch to your right hand now. So same thing. Go through each joint. Just tell me if it hurts at any point, okay? All right, so I'll start with your thumb again. So how's that feel? Okay. And is this one good? Awesome. Let's do your fingers. Any pain? Good. Any pain? Good. Any pain? Awesome. Next finger. Feel good? And here. It's good. And here. Awesome. And let's do this one. It's good. And what about here? It's great. Here. Okay. And let's do the last finger. So how's that? It's good. And that one. Good. And the last one. It's great. Awesome. It's really good. Okay, so just bend your wrists back for me like this. And just don't let me bend it, okay? Alright, that's good. And don't let me bend that one. Alright, that's good. Alright, so now if you can just bend down for me. Okay, and back to straight. And now twist out. That's good. And now twist in. That's good. Okay, so now just flip your hands over for me. Bring your thumbs up towards the ceiling. Okay, and now bring them like so across the palm. Awesome. And now extend them out all the way. That's great. And now bring them up like so. Okay, and don't let me bend your thumb down. Great. And don't let me bend this thumb down. That's great. Okay, and now if you can just use your thumb to touch each finger for me. Good, and now this side. Alright, and that looks good too. So now just take your left hand and splay your fingers like this. Okay, and don't let me squeeze them together. Good. And now the other hand, splay the same way. And nice and strong for me, don't let me squeeze them together. Awesome. Awesome. Okay. Flip your hands. Okay, so now flip your hands like this. And I want you to squeeze into a fist. Okay, and now just open back up. Alright, good. Okay, so now if you can just open your hands and lay them flat on the table like this. I'm going to stick my fingers in here. And now if you can just squeeze as hard as you can. There you go, squeeze, 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 squeeze. Nice and hard. Squeeze. Okay, that's good. And now if you can just take your left hand and do this. Okay, and don't let me open that up. It's really good. All right, same on the other. And yeah, pinch it and don't let me open it up. Awesome. Okay, I'm gonna grab a pen here. So I'm gonna hand you this pen. I just want you to hold it like a pen, okay? So here you go. All right, yep, and then just hold it like a pen. That's good. And switch hands for me. And just hold it like a pen for me. That's great. And I'll take that. And okay, and what we're going to do now is a sensation test. So I'm going to touch different areas of your hands and wrists. So what I want you to do is just tell me which hand I'm touching when you feel the contact, okay? All right, so close your eyes for me and just lay your hands out flat there. Okay, and just tell me what hand I'm touching. Okay, so we'll get started. Left, right, and did it feel the same from one side to the other? Okay, so go again. Right, left, and does it feel equally the same on both sides? All right, that's good. Let's do another one. Left, right, and did it feel the same on both sides? Equal amount of sensation? Yeah, okay. All right, so let's go again. Right, left, left, and did it feel the same on both sides? Okay, good. And so we'll go again. Left, right, and did it feel equal? Okay, so just go ahead and flip your hands over for me now. And we'll just keep doing the same thing, okay? So tell me which hand. Left, right, it's good. And did it feel the same? Left, right, and still equal? Awesome. And I'll go one more time, okay? right, left, and so that it still feel equal. Awesome. Okay, so we're almost done. We just need to do one final test. So if you can just hold your hands like this for me. Okay, and we're just going to hold it for a minute. So I'll just count off for you, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, we're halfway there, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, and 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, and 60. That's awesome. You can stop now. Feel okay? Okay. All right, that completes the exam. I'm not really seeing anything that would indicate that we need to pursue any sort of additional exams or anything. So what I'd recommend is just trying to first take regular breaks from the typing, the computer usage. I would try to get up at least like 5 minutes every hour. Take like a 5-minute break every hour, if not a little longer. And that can be helpful not just for your wrists and hands, but your whole body, especially your shoulder, and especially the hips. Yeah, computer usage kind of takes its toll on the body. The human body wasn't exactly designed to sit at a desk for long periods of time, or any period of time really. I don't think there were a lot of desks during the early days of human evolution. So my recommendation is to take breaks regularly, get up, stretch, and then I personally also have some issues in wrist and hand as well. So I just like to stretch, just put a nice gentle stretch on the wrist, and I just like to experiment with it and see, just go by feel basically, and just kind of see what feels good and which directions create the most stretch or relief. And the same thing with the fingers, just kind of stretching them out. Sometimes just making more of a point to move them in different ways besides how you're using them with the keyboard and whatnot can be helpful. Okay, do you have any other questions? All right, well, I hope that helps, and feel free to see us again if things don't improve, but I think you should start to feel some relief there if you start to implement those tips, okay? All right, well, thanks so much. All right, take care. So I'm looking for any, so I'll take your left, and I'm just gonna feel down the forearm here. I'm just gonna feel down your forearm here. Okay, so now if you can just set your hands this way, flat on the table for me, making sure they look healthy, feel healthy. And now if you can just and just hold it like a pin for me. What I want you to do now is close your eyes, and I'm going to touch different areas of your hand and wrist, and I just want you to tell me if you can. And so what I want you to do is tell me which hand I've made contact with, and then I'll ask you if it feels the same in both areas, okay?